Coming up, we will be on location at Advanced Pain Medicine Institute in Berwyn Heights, Maryland, discussing a minimally invasive approach that can take the pain out of herniated discs with one of the Washington, D.C. area's leading pain medicine specialists, Dr. Reza Ghorbani. Dr. Ghorbani graduated with honors from Tufts University and completed a fellowship in pain management at Harvard University's Brigham and Women's Hospital. Dr. Ghorbani is a diplomat of the American Board of Anesthesiology with a subspecialty certification in pain management. He is a fellow of Interventional Pain Practice, the only certifying agency which tests the ability to perform interventional pain procedures, is a member of the American Academy of Pain and the American Society of Interventional Pain Physicians, among others. Welcome, Dr. Ghorbani.
Thank you for having me.
Oh, it's our pleasure to have you back on. We've got a lot to talk about regarding a problem that affects so many of us, namely back pain caused by a herniated disc. And I wanted to begin, if I may, by asking you to please tell us why this is so common and also maybe a brief history.
My pleasure. Back and leg pain is the fifth leading cause of doctor's visit in the United States. Most of the time it happens in the fourth and fifth decade of your life. Traditionally, if medication, physical therapy, and interventional procedures such as epidural steroid injections were unsuccessful, a conventional open back surgery, which is a major surgery, was in order. Nowadays, we're able to offer a minimally invasive procedure called percutaneous discectomy. This is a very safe, FDA-approved procedure, an alternative to open back surgery for patients who suffer from herniated disc and back and leg pain.
And what are some of the most common causes of a herniated disc? If you could please enlighten us on that, Dr. Ghorbani, before we get into more about the effective treatment option that you just briefly mentioned.
Herniated disc could happen at any time. As I mentioned, most of the time it's in your fourth and fifth decade. But simple things such as sneezing or coughing, to more aggressive things such as lifting or sports activities and falling and accidents, any of these things could cause a herniated disc.
It could literally be caused by, like you just mentioned, things that we just do on a regular basis in life.
Exactly. I just want to emphasize that when somebody gets a herniated disc and they develop back and leg pain, the first line of treatment being medication and physical therapy. If they do not get better within the first 4 to 6 weeks, it's very important to ask their referring physician to send them to an interventional pain specialist. Literature recently has shown that the best outcomes are when patients are having interventional procedures such as epidural steroid injection within the first 4 to 6 weeks of onset of the problem.
Okay, and then obviously if that doesn't work, or it's certainly not helping them enough as far as alleviating the pain or removing the pain, then this procedure that you just briefly mentioned a few moments ago would be the next step.
Exactly.
So speaking of this procedure, can you please tell us more about it?
Giving a little bit of a history of minimally invasive surgery, it goes back to 1795 when the first minimally invasive surgery was trying to be done. At that point, as you can imagine, since there was no fiber optic, the major issue was a light source trying to look inside a closed cavity, and they were using light candles.
Light candles?
Exactly.
My God, talk about way back in the dark ages, and they're trying to perform a procedure, they're using light candles.
In 1963, the first patient with a herniated disc received a chemical injected into the disc called chymopipin. Chymopipin was to resolve the disc herniation by dissolving the part that was herniated and compressing on the nerve root. Because of substantial complication associated with this material and this procedure, it was taken off the market. Since then, the first percutaneous discectomy was done in the early 80s, and it has come a long way in terms of perfection since that time.
So that's what's now the most effective treatment option. Obviously that's minimally invasive, as you just mentioned, and I take it gets very good results.
Exactly. The outcomes have shown that patients who undergo this procedure, about 90% improvement within a day or two, and they can go back to work literally the same day, the next day or a few days later.
Talking about immediate relief, basically.
Exactly.
Now, who would be a typical candidate for this?
A typical candidate for this procedure is somebody with a contained herniated disc, suffers from back and leg pain, somebody who has not had open back surgery at the same level that now they're having a disc problem, patient who is not having coagulopathy, they're not on any blood thinners such as Coumadin or Plavix. Their disc height should be at least 50% of a normal disc height, meaning that they don't have degenerative disc disease, and patient who is not currently having any infection going on or having a disc infection.
And what would be the advantages of this procedure, Dr. Ghorbani, over the other treatment options that have been available?
There are numerous advantages to this procedure. Number one is this procedure is done at a very short period of time compared to an open back surgery. It takes about 20 minutes. It's done in an outpatient surgery center, and patients can literally go back to work the next day or within a few days. The incision is through a puncture hole. And having a very small incision compared to open back surgery, their functionality is much better than having big back open surgery. The cost of this is much less than having open back surgery, and if somebody has to pay a co-payment, definitely it's going to affect their pocket. There is associated scar tissue around the nerve when somebody have an open back surgery. And with this percutaneous discectomy, the chances of that is close to zero. About 20 to 40% of patients having open back surgery are actually worse off after the surgery compared to before surgery. There's negligible blood loss involved with this procedure. There's about 90% improvement after this procedure the next day or a few days later. And the one-year follow-up has shown that the rate of reherniation of that disc is very minimal.